Hi. Today in Psychiatry in 5 Minutes, we're going to cover motivational interviewing. Now, motivational interviewing is not, come on, you can do it, but rather it's exploring the patient's motivation for why are they doing what they're doing. It's usually used in substance use disorders. The simplest way to think about motivational interviewing is that your job is not to lecture the patient, but rather your job is to find out why are they doing what they're doing? What's in it for them? So a shorthand way would be to ask the patient, what do you get out of doing this? What do you get out of drinking? What do you get out of cocaine? What does it do for you? Then, what does it cost you? What does it do to you? And get an idea with the patient which is higher, and you can get a better idea kind of what their prognosis is. Then what you do is you find a way where you would agree with what they say, usually is what it does to them, and say, I agree with you, and you try to go downhill to try to find out a better way to pursue things. So the guiding principles of motivational interviewing, sometimes people use the mnemonic rule, R-U-L-E, are resist the temptation to say, don't do that, don't do that. Understand what the patient's motivation, why are they doing this, what's in it for them, listen with empathy to the patient, and then empower the patient. Go downhill, what are they doing right, what could be helpful. And those techniques are helpful even if you're a busy clinician and you have literally 40 seconds, and you may only have 40 seconds, it's still helpful to say, what do you get out of this? What does it do to you? I think you're right. It does a lot to you. Maybe we can work on trying to get that better. That would be helpful. There are a variety of stages that patients go through, and sometimes these are test questions. Pre-contemplation is a stage where the patient's not thinking about change. So it's called pre-contemplation. They're nowhere close to change. Contemplation means they're thinking about change, that they're getting ready for change. After contemplation comes preparation, which is really action. They're getting ready, they're doing things, they may be making their appointments, they may be setting a quit date, that kind of thing. And then maintenance is when they're in the active process of working through the work of trying to get rid of the substance. And the final stage is relapse. Motivational interviewing techniques take in the understanding that relapse is part of the disease, an expected part of the disease. And so when it occurs, no one should be surprised and you say, okay, let's work through this and go through things again. So again, with motivational interviewing, what you're trying to do is ask open-ended questions, find out where the patient is at, affirm their positive statements, reflect back to them what they say if they seem to be confused, and summarizing sometimes can be helpful. You know, that you said this is what you get out of it, but this is what you cost. What do you think is worse? And I agree with you in what you're saying. And that can be helpful, especially in the very beginning, to try to light the flame, to have the patient develop more motivation to stopping substance use disorders. Thank you.